This feature is brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice.
All right, thanks for joining me on another episode of Views from the Front Porch, a podcast series about physical activity in rural America. My name is Christiaan Abildso. I'm an associate professor in the School of Public Health at West Virginia University. I'm really honored to be joined on this episode by our colleague, Dr. Noah Lenstra from University of North Carolina at Greensboro, UNC Greensboro, in Greensboro, North Carolina, of course. Welcome, Dr. Lenstra.
Hello. Yeah, great to be here. Thanks for having me.
Yeah, you have the sunshine. We got kind of gray here in West Virginia, but I think we'll be all right. First of all, would you, if you wouldn't mind, just tell us a little bit about yourself and your interest in rural physical activity, because you're coming about it from a different angle than a lot of us.
Yeah, absolutely. So I grew up in a small town in northwest Illinois. Yeah, the whole county had maybe 20,000 people, and outside of a town of around 3,000. And so every time I go back home, I see firsthand the problems of physical inactivity in rural America, with a lot of my family having various health issues, my parents, their cousins, that generation. And just talking with them and thinking about the changes that they've seen in their own lives. Most of them grew up on farms, working on farms, being pretty active pretty much all the time. And that's really not the reality at all in rural America today. And so just so much has changed so quickly in terms of how we spend our lives, what we do for work. And so there's a personal interest, and then just the professional interest was I've always worked in libraries. That's always been my interest. That's always been, and so just professionally seeing more and more libraries kind of get involved in physical activity promotion, physical activity partnerships, and really just thinking about what libraries could do, as they always have done in rural America, which is lend a hand when communities have a need. Libraries step up to help support it. And so that's kind of just briefly about me. I guess just in terms of my job title, I'm an assistant professor of library and information science here in the School of Education at the University of North Carolina. And as you mentioned, in 2016, when I came to Greensboro, I started this project called Let's Move in Libraries, really to just shine a light on what I was seeing libraries doing in terms of stepping up to promote physical activity and healthy eating.
It's awesome. I think the most important question is, how about yourself? What's your favorite type of activity?
Yeah, so I mean, I really love to run on a regular basis. I'm a later in life runner. I didn't start running until I was 29 and working on my dissertation, but I've really fallen in love with it. But the thing that probably brings me the most joy is hiking, which I do less often, but I think my life would be a lot less meaningful if I weren't able to hit the trails now and again.
That's awesome. I think your knees and your hips and your lower body, thank you for getting into running later in life. So you've been doing some really awesome work, really cool work, coming at it from a different angle than those of us who are trained in physical activity and public health. You're coming at it from library sciences and working in libraries. You've been really prolific in your writings on the role of libraries in promoting health and wellness and physical activity and healthy eating, especially in the rural areas. I mean, once a few of us started hearing about your work, we all just sort of did the palm to the forehead. We're like, oh yeah, libraries are everywhere. So a bunch of us co-authored that paper, the call to action on rural active living, that was published in JPHMP. And one of, there were a couple of the suggestions in that. We made eight suggestions in our call to action. And there are a couple that I'd like you to talk about. So you've been working a lot with, I think, colleagues in Oklahoma and Michigan, also in Vermont, to really address our fourth call in the paper, and that was to utilize qualitative studies to better identify and characterize the unique influential variables in rural America and rural environments. So you want to talk a little bit about that work and what your goals are and through the qualitative piece?
Yeah, absolutely. So on that project you mentioned, I really have the privilege of working with some experts on qualitative methods, including our amazing primary investigator, Ellen Rubenstein, who's on the faculty of the School of Library and Information Science at the University of Oklahoma. And she's done a lot of great qualitative studies over the years of how public libraries promote health literacy in a lot of different ways. And what we're doing in this project is really focused on trying to listen to rural librarians, their partners, and their communities in 16 small and rural places across the 4 states you mentioned, to better understand from multiple perspectives why it matters, or what libraries really bring to the table in terms of community health. And I would really say, in terms of, to your point about the value of qualitative methods, what we're really discovering is how unpredictable these partnerships can be. And to really understand the complexity of this reality, you really have to listen closely to kind of what's happening on the ground. And when the library gets involved, things can snowball really quickly, and you can't predict what will happen. You can't, and so I'll just give you a quick example. So last Monday, I was actually doing field work in eastern North Carolina, which, if you don't know, is extremely rural. The largest city has less than 100,000 people. So doing field work in a small town of 4,000. And there, the local librarian has worked with many other town employees, as well as volunteers, to actually install a disc golf course to increase physical activity. And the story of how that came to be is just so kind of, has so many twists and turns in it. It itself could be a novel. And so, just a short version, in 2014, the librarian got involved in a project out of UNC Chapel Hill to check out pedometers. And that project to check out pedometers from the library really inspired the librarian to think about what else he could do to promote walking and walkability in his community. And so then he got involved in a fledgling 5K that the town had started to do every May. And so he worked with the town's Parks and Recreation Department to start an informal Couch to 5K program, really focused on increasing walking, so Walk the 5K. And during the program, the librarian brought in guest speakers to talk about healthy living. And he also had available inspirational books that you could check out after the training. And around that time, the librarian became a kind of informal wellness advisor for the town. And one of the things that he did was actually work with the town council to pass an ordinance that enabled town employees to be eligible to take 2 15-minute paid walking breaks every week. And to encourage participation, the town government, the unit of town government that walked the most won an annual prize. And so when the town started thinking about walkability and increasing walking, of course, they naturally turned to the librarian, who at that point had been involved in so many different things that they were just a natural choice, a natural ally. And so the town was really trying to do this without any sort of real budget. And so when a wealthy landowner passed away and donated a big wooded area on the edge of town to the town, the Greenway Planning Committee, which by that point had the librarian as a member, thought this could be the low-hanging fruit. We need to get the ball rolling. But after doing some informal community needs assessment, they thought it was probably a little bit unlikely to get these residents of this rural town to go out hiking, but people were into sports. So, well, maybe we'll have a disc golf course and we'll call it like sports, but really we're just trying to get people out walking. And so every morning for months, a group of volunteers, often led by the librarian, would be out there in the woods clearing paths. And now the disc golf course is finally open. And so I talked with a member of the town council, and he estimated that 50% of the users are from the small town and 50% are coming from out of town. So it's also contributing to economic revitalization of the community, which has changed quite a bit in the economy. And so really to make a long story, the short lessons are really, for me, it's just when a librarian gets involved, you don't know what's going to happen, but you know something good is going to happen, and that's really the main lesson, I think.
That's pretty modest. The librarians, yeah, well, I mean, and as you look in rural places, the workforce is limited as far as
Mm-hmm.
promoting physical activity. So any trusted person, yeah, is awesome to get involved. It's a great partnership that, it's good to see all the things that are happening. It started with something small, literally
Mm-hmm.
baby steps with pedometers, and became
Yeah.
policy change, and now the
Mm-hmm.
entire built environment change. That's pretty awesome.
Mm-hmm.
Well, thanks for that story. I mean, that's a good example of how the qualitative stuff can really add to it and tell the story of really how to get after it in rural places. So, I'd like for you, if you wouldn't mind, talk a little bit about your work through Let's Move in Libraries as the director of that. So, we've been talking about it a little bit. I mean, this really hits at, and the example you used from the qualitative study really hits at, the social ecological model that a lot of us have been influenced by, that Jim Dallas and colleagues published, almost 15 years ago now. And it's using that model to guide the establishment of something that's specific to rural places, because it's very much built on urban evidence. So if you wouldn't mind talking a few minutes about what you found through all, talk a little bit about the things, you're doing to collect information for Let's Move in Libraries, and a quick snapshot of what you're finding. I think that would be great.
Yeah, yeah, absolutely. And so Let's Move in Libraries, I mentioned, it started in 2016, and it's really had two phases. So when I first started it was really based on what I was hearing was that there were lots of people like that librarian I mentioned, kind of doing lots of experiments all over the country, but they were doing so in a context where they really were not feeling like they had much support at kind of the national level. There was no real national infrastructure to enable people to kind of like share what they're doing, swap notes. And so that was kind of where it started, thinking about how we could use technology to kind of facilitate that kind of peer-to-peer support network among librarians. And then by going to venues like the Active Living Conference and getting involved in some of these networks, when I kind of realized that we need to expand it outward, and where it's at now is it's still trying to provide that peer-to-peer support, but also trying to raise awareness about public libraries among potential partners, whether they be Parks and Recreation, public health, cooperative extension, what have you. And so, yeah, so just as the project has grown, I've really discovered over and over again that there's a big hunger for resources. And one of the most unexpected ways that I found out about that is that working with UNCG, I was able to get a small amount of money to hire a graphic designer to help with the website. And we designed the logo for Let's Move in Libraries. And that logo resonated way more than I expected it would. People asked me, can I download the logo and put it on my flyers? And people have made banners, they've made T-shirts with the logo. I mean, because it was really like, it was a hat that people could hang or it was a hook that people could hang their hat on. Like, see, I'm not just some crazy librarian. There's actually there's a national infrastructure around that, and just that hunger for kind of resources was really. And so it's really grown. I think right now we have about 2,500 people subscribed to the monthly newsletter. It's really taken off way more than I could have predicted when I started, which I think is true in lots of things in libraries.
That's pretty awesome. I mean, have you, what kind of evidence do you have on I mean, are you at the point of collecting evidence on programs, or just cataloging programs right now and best practices? What kind of stuff have you published on it?
Yeah, that's a great question. I would say right now, and really my main area of interest is really on the diffusion of innovation. And so thinking about how new ideas kind of get taken up and absorbed into professional practice. So I have up to now kind of focused less on kind of the end impact of all of this. But I have definitely recognized that that's really what's needed. Is to really take this to the next level, is to really kind of do more in-depth evaluation and assessment. And so as part of the project we're working on right now that I mentioned, the first part of that project is really interviews with librarians and interviews with the partners that they've worked with. And our next phase is actually going to be going in and talking to people that have participated in these programs in these different communities to learn more about the impacts it's had on them. But yeah, up to this point, it's been more kind of looking at kind of the diffusion of innovation of new practices. But definitely, I think one big need right now is to do assessment to help us better understand kind of what impacts yeah, these different programs and partnerships are having.
Yeah, I mean, it sounds like from that, even just that one interview you talked about in Eastern North Carolina, you have the kind of the process of that. You have the policy change, you have the environment change and the system kind of stuff, but which will lead to the outcomes, right? It's just now cataloging those outcomes and what are they, and then maybe developing a model for that. That's awesome. Are there any specific resources that anybody, let's say if somebody listens to this and is interested, you know, is there a website or should they just contact you directly? What resources do you have to share?
One resource I would definitely share is Let's Move in Libraries, which you can get to just by going to letsmoveinlibraries.org. That's the main, and then we also have social media presences on Facebook, Instagram, Twitter, and YouTube. I mean, I would say also just another quick reminder that libraries are really idiosyncratically local institutions. So the 17,000 libraries across the country, almost 90% of their funding comes from local sources, whether it be county or municipality. So really, if you want to get started, my advice would be to reach out to your local librarian and to really embrace the power of the local, and kind of what I think sometimes the best way to get things going is just through those conversations and relationship building at the local level.
Yeah, I mean, that's awesome. You cite the total number of libraries. I mean, how many of those are in rural communities? Do you have any idea what percentage? Depending on how you define rural, of course.
Yeah, I mean, that's a good question. I do know that the majority of them are in kind of considered town or rural context. So the Institute of Museum and Library Services, which is the funder of my project, they do an annual public library survey that catalogs all the libraries in the country. And I should have looked this up before, but I do know a majority, so over 50% of the libraries are in small town or rural contexts. The other two contexts being suburban and urban.
And do you see at your national meetings or other professional organizations a training? I mean, are people learning what is physical activity and how do you get people to move? I mean, is that starting to become an emphasis?
It is, I would say again, it's bubbling up from the local, so it's probably taken the longest to kind of percolate into the national venues. But I see it at more and more state library conferences. So, for instance, actually, the state of Michigan, the Library of Michigan, has an annual Small and Rural Libraries Conference. And so one of the sessions is led by a librarian talking about physical activity promotion at her library. There's a similar one coming up at the Connecticut Library Association conference in April, also at the Maine Library Conference in April. So there was a similar session last month at the Nebraska Library Commission's conference. There's been similar sessions in Kansas. So I think as things tend to do with libraries, innovation starts at the grassroots, at the local level. It then kind of percolates up to the state. And I predict that in a few years, it'll finally make its way into our national infrastructure. But that's what like policy does not come from the top down in libraries. It's the absolute opposite.
Right.
And I think right now it's bubbling up from the local to the state, and it's going to get to the national soon.
Well, that's awesome. I was going to ask you for a final topic, but I think that's a pretty good one. Unless there's anything else, obviously contact your local librarian. Is there anything else anything you'd like to close with?
No, not at all. Just that it's been really wonderful kind of getting to know people and kind of the physical activity, active living space. And so just thank you again for the opportunity.
Yeah, we appreciate it. I've loved following you on Twitter and seeing all the different things happening and all the cool stuff. So, well, I think that's going to be it for this episode of Views from the Front Porch, or from my back porch. It looks like your back porch too.
Yeah.
So,
Yep.
No, I really appreciate your time and definitely keep up the great work.
Great. Thanks, Christian. Have a good day.
Yeah, you too.
Bye.
This feature was brought to you by JPH MP Direct, the companion site of the Journal of Public Health Management and Practice. To learn more about the research discussed in this talk, visit us online at jphmpdirect.com.